everyone, I'm Danny Roddy of DannyRoddy.com, and today I'm talking with Georgi, an independent health researcher and owner of IdeaLabsDC.com. Today, Georgi and I will discuss heart disease and stroke from a bioenergetic point of view, or the interaction between an organism and its environment, and how those changes influence cellular respiration. In addition to thanking Georgi for talking with me today, I'd like to thank my patrons for making this show and all the content I produce possible. If you would like to become a patron, please go to patreon.com/DannyRoddy. As always, please do your own research and come to your own conclusions, and in the spirit of William Blake, the true method of knowledge is experiment. Without further ado, here's the show. I wanted to talk about why we decided to do this episode. And basically, my dad had a stroke, and that was like one of the first times any family member besides myself has had a serious health problem.
Okay.
And he's like super overweight. Like he eats like shit, and it's not surprising. But what I was really found the worst part about it was my mom texting the whole family and telling us what was happening, like what they were doing. And it was all structural stuff. It was like an MRI. And like, I was like, did they like measure anything in his blood? And they were like, well, they got his cholesterol level and it's high. And so I was just like, oh God, like this is annoying, not because my dad's life, like I don't want my dad to die, but just because of how incompetent the system appeared through my mom texting everybody because I wasn't there.
Yeah.
And I guess her anecdote about the whole situation was like, they have no idea what like causes this. And my dad went home not having any idea, like more so of what happened, what caused him to have a stroke when it was happening, much less when he got home from the hospital. So that was my motivation in asking you to do this heart disease and stroke episode.
Sure.
And any background you had about like the mainstream view and why perhaps other people have gone through a similar situation with a loved one or themselves, and what is the mainstream's view towards heart disease, but also strokes? Like what do they think is happening there?
Yeah, actually, this kind of strikes close to home as well, because my maternal grandfather had 4 strokes and 3 heart attacks.
Wow.
Before he actually died on the street from the 4th heart attack. I'm sorry, from the 4th heart attack. And basically, that was it was in Bulgaria in the early 90s, but I don't think the mainstream view has changed much since then. If anything, it has probably taken a turn for the worse, because basically the bottom line is, aside from the statement that a lot of this is genetic. Basically, if you have heart failure, I guess there are 2 main kinds. There's heart failure and cardiovascular disease, and one of them is associated with the weakness of the actual heart muscle, and the other one is associated with the calcification and narrowing of the blood vessels. And the only official statement that we have so far that everybody agrees on is that they each one tends to contribute or directly cause the other. But what causes, what's the original cause for either one of these to develop? Basically, the official version is that it is unknown. The official statement is for heart failure, the official cause is cardiomyopathy of an unknown cause. Cardiovascular disease, they're saying that the main causes are atherosclerosis. And what's the cause of that? Well, a number of things. Again, the genetic component is very high. But whatever is not genetic is attributed to usually obesity, diabetes, kidney failure, liver disease, and of course bad diet. And by bad diet, that means eating too much saturated fat, eating too much salt, eating too much high cholesterol foods, drinking too much. Some of these things are probably not bad conceptually, especially the alcohol drinking. I think the evidence on that is pretty solid. But some of the other stuff is ridiculous, considering that studies from the pharmaceutical companies themselves show that, for example, and it's good that you bring up your father's case here, people with the highest cholesterol titers were the least likely to die as a result of an actual myocardial or cerebral event, like from a stroke or a heart attack. So basically, even if cholesterol contributed, you're much less likely to die the higher your cholesterol is. So overall, basically, the statement is we don't know what's causing it, but if you don't want, since you already have it, probably. And by the way, they did studies on soldiers in the Korean War and the Vietnam War, and even though the average age of these soldiers was only 22 years, over 70% of them had majorly blocked arteries around the heart, and especially the carotid arteries, which supply the brain and the neck and the spinal cord with blood.
I referenced, just to interrupt you real fast, I referenced a paper, and I forget which article, which I think it was in Japanese children in like the 50s, but nearly all of the kids or the people over 20 had the beginnings of atherosclerosis. And then I think a majority of the kids under 3 years old had it too.
Yeah, basically, there's an American study that replicated that in the late 90s, and it basically said that in children as young as, basically, I think that they looked at a really large cohort, maybe 100,000 children. Basically, they collected data that the physician somehow got inadvertently, and the average age was between 7 and 9 years, and all of them had some kind of lesions. There was no child that had no atherosclerotic lesions whatsoever. All of them had various forms, basically, of atherosclerosis. Just not bad enough for itself to manifest in terms of blood flow problems or heart beating problems and things like that. By the way, the incidence and the age has been dropping. I mean, those studies were in the 50s with the soldiers were in the 50s and the 70s, the Korean War and the Vietnam War. When they were doing those studies with children at the time, the children were pretty clean. They were pretty healthy. And now, basically, it seems like that age has been dropping from 22. It went down to as young as 3. Given that the genetic component officially is no more than 10%, if at all, right? Let's assume it's 10% for now. The other 90% are publicly admittedly due to some kind of environmental factor. And currently the claim for this environmental factor is predominantly bad diet and eating too much saturated fat, and all the things that actually reduce the likelihood of you dying if you have such an event.
So do you want to talk about the role of, when you talk about heart disease, at least I don't know about stroke as much, but people talk about HDL and LDL, and you already touched on the high level of cholesterol being associated with or having an inverse relationship rather with the metabolism. Do you want to talk about HDL and LDL and how the good and bad tag along with those names is just totally preposterous?
Yeah, sure. I guess as I said at the beginning, they're basically, let's split them into two main kinds. One of them is the heart failure type of heart disease, which is really like the weakening and the destruction of the myopathy of the heart muscle. And I'm saying muscle, I'm emphasizing muscle because we'll see how this parallels with other conditions like muscular myopathy of the skeletal muscle. And then there's also the cardiovascular disease triggered by atherosclerosis. And let's start with atherosclerosis process. Basically, even though the mainstream view and everybody thinks that cholesterol is the cause, in fact, even the mainstream view, if you look at the actual textbooks, will tell you that that's not the case. The majority of the plaque that's actually lining up these vessels is composed of dead and alive white blood cells. So it does seem to be an actual immune reaction. There is a guy in Germany who has proposed to look at atherosclerosis as an autoimmune disease of the vascular system. Basically, the process is the same. It looks like, for whatever reason, if you don't know any better, it looks like the white blood cells are attacking the lining of the white blood cells are attacking the lining of the blood vessels. And what happens is that basically, as these white blood cells accumulate, they form basically the innermost layer. As the cells along the wall of the vessel start to die, basically calcium accumulates as well. And finally, cholesterol rushes in. And originally it was the claim was that cholesterol was the cause of the outermost layer of the plaque, but now it seems that cholesterol is going there to actually try to limit the inflammation and protect the vessel. Over time, basically, what you have is this increased immune reaction attracts to itself cholesterol and also the calcium from the dying cells, and eventually, this is what forms the plaque. And there are studies that show that all of these issues are virtually absent when vitamin K status is adequate. And there are also a few studies in animals that show that given supplemental vitamin K, especially the metatetranone type, the MK4, fully reverses the calcification of those blood vessels. In a sense, it reverses atherosclerosis. And by the way, one of the main drugs that's given for atherosclerosis, warfarin, is a vitamin K antagonist, and it's well known to cause calcification. So something is seriously messed up, because even the official view is that atherosclerosis is an inflammatory disease. It's the body's reaction to inflammation of the blood vessel, and cholesterol is not really a cause any more than basically being there as a bystander, trying to repair the damage and contributing to the formation of the plaques. But it's really not cholesterol. By lowering your cholesterol, what will happen is that there will be no way to control this inflammation in the blood vessel, and eventually that blood vessel will probably rupture, and will give you either a disastrous hemorrhaging stroke, which are probably more dangerous than the ones caused by blockage, or if one of the major aortas or veins rupture. I mean, this can have lethal consequences very quickly. So cholesterol is trying to do good. It's not there to kill you somehow. It's trying to repair the damage that has been done over years of inflammation. We can get to the point of what is the main cause of inflammation: the precursors, the inflammatory mediators that are formed from arachidonic acid. And what's arachidonic acid? The metabolite of linoleic acid, the major PUFA that everybody tells you is essential for you.
Okay, I want to get there. You mentioned the heart muscle and the skeletal muscles being similar, and how that understanding what happens when the heart muscle is stressed, it's de-energized, it's accumulating calcium and sodium in water. Did you want to talk about how the myocardium is influenced by the hormones, and like the energetic or the bioenergetic view of this, like what's happening in the heart?
Sure. Basically, I guess that's the second type of cardiovascular disease that we're going to cover. It's the so-called heart failure. And there are two types, the systolic and the diastolic. In other words, either the heart can't pump enough blood, or it cannot relax properly and it cannot empty itself. Both types of heart failure are equally dangerous, in my opinion. But it has been shown, I think, as early as the 20th century, that the stress reaction, basically a very strong stress reaction that is strong enough to create a shock-like state, damages the muscle of the heart and causes the cells of the muscle of the heart to swell and to retain water. So just a temporary strong stress reaction is enough to sort of cause a temporary heart failure. Now, of course, with proper thyroid function and everything else, that is likely to be repaired. However, if this is repeated and it continues, little by little, there's damage and accumulation of calcium, just as you said, and eventually the heart cannot fully relax and also cannot pump blood either. And one of the major mediators of the stress reaction is estrogen. Estrogen is basically prevents the heart from pumping blood properly, and also prevents the heart from relaxing properly. And the effect of being able to pump strongly and enough blood is called the ionotropic effect. And the effect of being able to relax is called the lusitropic effect. And estrogen is a negative ionotropic hormone and a negative lusitropic hormone. It's probably the worst thing you can give to your heart. It inhibits with its ability to pump blood, and also it interferes with its ability to pump blood, and also it interferes with its ability to relax. And some of the hormones that are positively ionotropic and positively lusitropic are, above all, progesterone, testosterone, dihydrotestosterone, and in some cases, dehydroepiandrosterone or some of its metabolites. The latter part is not clear yet, but it's known that some of the metabolites or DHEA itself is also beneficial. And all of these steroids happen to act in a largely opposite manner to estrogen and also cortisol. And by the way, the heart muscle is one of the highest concentrations of testosterone, it's necessary because given how cortisol is likely to rise in any situation of stress, basically the heart is probably the last muscle that you want to get destroyed by cortisol and turn into amino acids and consequently glucose. So the heart has a very high concentration of testosterone, and it is believed now that the purpose of this testosterone is to protect the heart from the negative effects of estrogen and cortisol. So basically, there you have it. Estrogen, by contributing and actually being the major carrier of the stress reaction, damages your heart. And some of the known steroids that are known to oppose estrogen, especially progesterone, are known to interfere with its activity and restore proper heart function. There are some other substances that act similarly to progesterone. As a matter of fact, they raise progesterone levels in the blood. One of the best known examples is caffeine. Caffeine itself is also, unsurprisingly, both positively ionotropic and positively lusitropic. And the overall state of heart failure is, you can think of it as basically as a persistent fatigue in which the cells don't have enough energy to expel the calcium that has gotten inside of them. And in this fatigue state, any cell that is fatigued will swell and retain water. Whenever the muscle, you can see this sometimes in your skeletal muscles. When the swelling of the muscles is really bad, they have a very hard time contracting. You can ask an athlete, or you may have experienced yourself from basically from an extensive workout. If your muscles are swollen, you don't have the ability to do much with them, and they're very hard to stretch. And stretching is good and is kind of opposing to the swelling. It has been shown that stretching increases the synthesis of ATP inside the cells, especially the muscles. The overall conductor and guardian of all these processes that are good for the heart is, of course, thyroid hormone. Thyroid hormone is, just like progesterone, is positively inotropic and positively lusitropic. It opposes estrogen. It lowers, and I guess the real question is then, why does estrogen cause these things to happen? Ultimately, it comes down to bioenergetics. Estrogen inhibits the ability of the cell to utilize glucose. It increases lipolysis. It raises the levels of free fatty acids in the blood. But unlike some other forms of lipolysis, estrogen itself favors the release of the highly unsaturated fats, especially EPA and DHA. And those are known to directly inhibit the contraction of the muscle. And they're actually, the EPA and especially DHA, which is the most highly unsaturated fat that's probably in your body, has been known to be the most strongly negatively ionotropic substance, stronger than even estrogen. This whole process of oxidation of fatty acids, inhibiting heart function, and oxidation of glucose, promoting heart function and relaxation, this has been known since the 60s in some European countries. There is a drug that was originally developed in Latvia. It's called mildronate. And I think Ray P talked about it very early on, I think back in the 60s and 70s. And mildronate is, for lack of a better word, is a functional carnitine antagonist. So carnitine is the amino acid that's responsible for the oxidation of fat. So anything that antagonizes carnitine is going to contribute to reduction of the oxidation of fatty acids, and which will give the cells the opportunity to oxidize glucose. Mildronate was developed as a drug for heart failure, since it has been found that it can be used as a performance-enhancing drug in virtually any sport that involves exertion, I guess with the exception of chess, because you're flexing your brain there, really. But mildronate its primary mode of action is inhibiting fatty acid oxidation and promoting the oxidation of glucose. And you don't need to get mildronate. There are some substances that are well known that have largely the same effect, even though through different mechanisms. Niacinamide is a very well known, and vitamin E is also another very well known. And vitamin E has also a very good property because not only it inhibits lipolysis and the release of free fatty acids, but it also it's capable of directly destroying some of the really bad ones that are floating around in the bloodstream, specifically the highly unsaturated ones, EPA, DHA, and linoleic acid. So those are some of the good things you can do to improve your heart function.
I want to talk about aldosterone, and I think that's actually a mainstream view that angiotensin 2 and aldosterone are involved in heart attacks. And you mentioned how estrogen is bad for the heart, and I'm pretty sure estrogen increases aldosterone because of the swelling, and the sodiums move from the extracellular tissue into the cell. Is that right?
That's right. And aldosterone is widely recognized as one of the primary contributors to heart failure. And, it's funny, if you admit that that's true, then the whole guideline of restricting dietary sodium makes absolutely no sense. One of the primary reasons aldosterone will rise is to retain sodium because the body thinks you're not getting enough. So what happens is aldosterone will rise and the body will retain sodium at the expense of magnesium and potassium. So basically, you will retain sodium at the expense of these vital minerals without which the cell cannot relax. So as long as you're in a state of elevated aldosterone, by the way, aldosterone itself promotes the synthesis of both cortisol and estrogen. So aldosterone is another part of the sickness fields when applied to heart failure, because as long as you're producing high, as long as your aldosterone is high, your blood pressure will be high. The body will be doing everything possible to retain the little sodium that it has. And it has been shown that basically whenever you give people sodium, there is a slight, let's admit it, there is a slight blood pressure raising effect, but that disappears within 20 minutes. And after that, blood pressure normalizes. And people who are given diuretics to basically, expel this water that's causing all the swelling, and which also has the effect of increasing sodium excretion, have been shown to have dramatically higher rates of sudden cardiac death. It's a condition, really, a situation where not much can be done. The heart stops all of a sudden, and not even adrenaline injections directly into the heart can really revive it. And I'm bringing up adrenaline for a very good reason, because adrenaline is yet another one of these of the components of the sickness field, and adrenaline is always elevated in a stress reaction. Whenever adrenaline is high, many people think of adrenaline as something that's given to revive people. Maybe in the short term, maybe as an acute effect. However, adrenaline chronically contributes to the sickness field by elevating the levels of free fatty acids, and adrenaline itself is also a negatively ionotropic hormone. All of this stems from really two things: stress and bad diet, just like mainstream medicine says, but they have it backwards. The stress reaction is well known, but the mediators that the mainstream medicine says, well, we don't know what the mediators of stress are. And in some cases, they even recommend estrogen for treating heart disease. Well, that's bunk. And also the second part is reduce your saturated fat intake and increase the polyunsaturated fat intake. However, even the Wikipedia page on atherosclerosis currently says the following. A 2013 meta-analysis concluded that substitution of the saturated fat with the omega-6 linoleic acid dramatically increases cardiovascular risk. And also, another study found that replacing the saturated fat with omega-3 fatty acids also increases cardiovascular risk. So the mainstream view, at least as far as the public is concerned, is that the polyunsaturated fat is bad. Many people have probably recently heard that the FDA reversed its decades-long stance on cholesterol. It said, you don't need to worry about cholesterol. We've been telling you it's horrible for you for the last 40 years, but don't worry about it. Go ahead and eat all the eggs you want. Eat all the meat you want. Eat all the saturated fat you want. It does not matter, right? Well, that's wrong too. It does matter. And as I mentioned earlier in the show, the higher your cholesterol levels, the lower the chance that you will die if you have a cardiovascular or cerebrovascular event. And by the way, there's a very old study. That's one of the first things that I posted on the Rapid forum. It showed that people that were admitted to the emergency department with either a heart attack or stroke, the ones that were the most likely to die were the ones with the highest levels of estradiol in the blood. Basically, that's I don't think it gets any better than this. People with the highest level of estrogen had the highest, and also some kind of a cardiovascular or cerebrovascular event, had the highest chance of dying. The picture is backwards. It's energetics that really matters, because without energetics, there can be no structure. Almost every tissue in the body tends to disintegrate if it does not have a sufficient supply of ATP to maintain its structure. And currently, the way we're being treated, if you go to the hospital, is basically they treat you like you are a car. We can replace this part or replace that part. And if nothing shows on the imaging, they're saying basically that you are unremarkable in every respect of the word. And then they discharge you home with statins and diuretics. Those are currently the two mainstream therapies. And these two. Let's talk a little bit about it. That these are terrible medications. We already kind of hinted to that in regards to the diuretics, because they make you lose more sodium, in which case aldosterone will rise. Aldosterone will trigger more cortisol, more estrogen, and actually more adrenaline. And then it will contribute to the pathology that got you into the hospital in the first place. So diuretics as a whole are really, I think they're more or less a dead end, at least the diuretics that are being used mainstream. There are safer diuretics. There is a safe way to get water out of the cells, and those tend to be the drugs that increase the production of carbon dioxide in the body or reduce its degradation. A very old drug called acetazolamide is a drug that Ray has talked about sometimes. It is a carbonic anhydrase inhibitor. In other words, it inhibits the degradation of carbon dioxide, and it also happens to be a diuretic. However, you're not going to hear that, even though it is being used to treat the so-called pseudotumor cerebri, which is the increase of intracranial pressure, basically in your skull, which can herniate your brain and kill you. And it has been known basically to reduce the production of the cerebrospinal fluid. And if you have too much, it'll make you excrete it safely. So that is a safe diuretic drug. It doesn't make you lose sodium. It doesn't make you lose potassium and magnesium because sodium is low. But the mainstream diuretic drugs are really bad. And the statins are actually really bad too, because they deplete the tissue levels of coenzyme Q10. And that enzyme, the levels of that enzyme are crucial, especially in the heart and the skeletal muscle. Without that coenzyme, muscle tissue starts to disintegrate. You're basically getting myopathy. The levels of creatine kinase, which is the enzyme, it's a blood test which they use to test basically how much of a muscle breakdown you have. And the heart is a muscle. The levels of creatine kinase rise. The levels of lactate dehydrogenase, which is an enzyme which we talked about before, can be used both to diagnose cancer, but also acute elevations are indicative of a heart attack. Whenever you deplete CoQ10, levels of lactate dehydrogenase rise as well, which of course would contribute to the increase of lactate. Lactate itself is a hypoxic chemical. It inhibits metabolism even more, and the whole cascade of sickness continues and goes on until people figure out that statins kill people. By the way, statins currently there's a class action lawsuit going on against the makers of Lipitor. I don't know I'm pretty sure it's Pfizer that made Lipitor. There's a class action lawsuit because it's pretty certain at this point that statins, if taken long term, cause some of the lethal neurodegenerative disease, especially amyotrophic lateral sclerosis, ALS. There's a class action lawsuit going on right now. So there you have it. The current therapies essentially kill you.
Do you want to talk about the things that modify the blood volume a little bit and what's actually going on there when there's a decrease in blood volume?
One of the main things that controls blood volume is how much sodium you have. If you don't have enough sodium, blood volume will decrease. And the reason it decreases is because all of the volume that's in the blood, basically the water and everything that it carries, it goes into the intracellular space, right? Mm-hmm. And if the cell cannot expel it back, that contributes to a decrease in blood volume. So there's literally less amount floating around in your blood vessels. And the way the heart compensates for that is by constricting your blood vessels, right? Because then basically if you constrict the blood vessels, functionally blood volume will increase. But that's a very bad way. I mean, basically, ultimately it puts stress on your kidneys, right? So if this continues unopposed for a long time, this will destroy your kidneys, and that in itself can contribute to even a higher blood pressure through the release of the angiotensin enzyme. Angiotensin, I think there are two forms, 1 and 2. If blood volume is low, there'll be compensatory mechanisms that may be good in the short term, such as if you're in a shock state. However, if they continue chronically, this will contribute to the destruction of your kidneys and the entire cardiovascular system because it will also increase calcification. In other words, if blood volume is low and the cells are not operating properly, they will not be able to expel the calcium, right? And it's evident what happens in cases like the endothelial cells that are in your blood vessels. If they cannot expel calcium, eventually this will contribute to calcification. Two primary reasons of low blood volume. One of them is low sodium intake, and the other one is low protein intake or liver disease. Either one leads to insufficient production of albumin, and it's really the albumin that is one of the main determinants of both blood volume and how nourished the cells are. It's albumin that carries stuff into the cell. So thyroid hormone, in order for it to get to the cell, two things need to happen. There needs to be albumin, and also albumin needs to not be bound by the free fatty acids, especially the PUFA. So another reason PUFA is that bad is because it binds to albumin, prevents it from carrying thyroid hormone inside the cell. I mean, a very well-known drug, which I think it's recognized that it's really only helpful in a very short term. It's called nitroglycerin. Its effects are effectively to raise the levels of nitric oxide in the blood vessels and sort of force them to relax. Well, if this is an adaptive mechanism, right, you don't want to be relaxed in the blood vessel. Even though it's not good to have high blood pressure, you do need this blood flow and the nutrients going to the cells. Otherwise, you have cellular hypoxia and tissues can start to die, such as gangrene in people with diabetes and heart disease, which is very common. Or chronic hypoxia may eventually result in cancer. So one of the very old drugs that was designed around this flawed theory and methodology was nitroglycerin, and its effects are to increase nitric oxide. And nitric oxide, yes, it does relax your blood vessels, but it's also a highly pro-inflammatory substance. So if the mainstream view is that inflammation is the primary trigger and the contributing and the underlying cause of atherosclerosis, the last thing you want to do is give them one of the most potent inflammatory substances, right? Nitric oxide, because this is going to trigger an even stronger immune reaction, even though it may, in the short term, decrease your blood pressure. The safe way to decrease blood pressure is to increase the levels of carbon dioxide in the body. It acidifies the cell. In other words, it helps it expel its water. And this immediately leads to an almost immediate decrease in edema. And this effect is easily seen with drugs like acetazolamide in patients that have edema in the lower extremities or edema of the brain. Taking acetazolamide as little as 250 milligrams, which is usually a single pill, within 2 hours removes all the symptoms of this pseudotumor cerebri, which is basically increased intracranial hypertension or the swelling of the lower extremities in people with kidney failure and heart failure. Carbon dioxide, that is the proper physiological relaxant of the blood vessels, not nitric oxide. Nitric oxide, its physiological role is primarily to battle pathogens, so it kills them. So you don't want to increase something that's used as one of the primary weapons to destroy pathogens that are invading your body. And it's known that it's very highly pro-inflammatory. And for people that don't care about these two things, I'll tell you that there's a recent theory that says that it's not theory. It was recently confirmed that elevated levels of nitric oxide may be the primary cause of multiple diseases like multiple sclerosis developing. I mean, it will be the actual trigger. It's estrogen that's underlying cause, but it is really the nitric oxide that triggers the initial demyelination of the nerves and destroy the destruction of the myelin. So it's not something you want to have elevated chronically. It's used by the body short term to mainly to battle pathogens.
Correct me if I'm wrong. It's known that endotoxin and serotonin are involved in stroke. I remember, I think, a call-in with Ray, and he suggested that somebody's parent might have had a stroke because of the endotoxin. Before we get onto various things you can do you want to talk about endotoxin and serotonin and how they contribute to not only stroke but heart disease too?
Well, absolutely. I mean, endotoxin is a highly inflammatory substance produced by bacteria in your gut. Its other name is lipopolysaccharide. So it is a type of sugar, really, produced by bacteria when they're irritated or when they're given food. And some of the primary food of this bacteria in your gut that produces LPS, lipopolysaccharide, or endotoxin are those resistant starches that almost every cardiologist will tell you are good for you. So every time you feed these bacteria and every time you eat food that doesn't digest properly within the first two sections, namely the stomach and the small intestine, once it reaches the colon, this bacteria will basically digest this food and produce endotoxin. And once that endotoxin gets in the blood, it is treated by the immune system as an invader, as a pathogen, which it is. So this will trigger an immune reaction. And also, endotoxin itself contributes to the bacterial, to the irritation of the so-called chromatin cells that lining your intestines. And it's those chromatin cells that are responsible for producing over 90% of the serotonin in your body. We talked about it before, but it's been shown that animals that have their guts, their colons cleaned out by taking antibiotics for about a month, they produce only 10% of the serotonin and almost no endotoxin. And these animals are remarkably resistant to heart attacks and chronic heart and cerebrovascular disease. Serotonin is the primary mediator of fibrosis in the body. And heart failure is characterized, many tissue failures are characterized by increased fibrosis. It has been shown that serotonin is the primary contributor of heart fibrosis, especially lung fibrosis, liver fibrosis. It is well known that people with a carcinoid syndrome, one of the major causes of death is actually liver fibrosis and liver failure. And these people overproduce serotonin. Recently, there have been some successful trials of using anti-serotonin drugs for heart failure and for preventing heart disease. But the official statement is that the results are still very preliminary, that not much is known what the mechanism is. Well, the mechanism is there. Serotonin is a fibrotic substance, and opposing it or reducing its production by eating properly and not feeding your bacteria can reduce dramatically your risk of developing heart disease and actually having an acute event such as stroke or a heart attack.
So what are some things people say you're scared about having a heart attack or a stroke? What are some things people can measure either at home or in a doctor's office or go get labs? And then two, what are like the most simple things you can do to provide protection against those events?
I think that everybody has heard of aspirin and its effects on events like stroke and heart attack. And that's probably the primary substance that I would recommend for many reasons. So we've talked about the role of estrogen, the role of free fatty acids, the role of serotonin, and aspirin happens to oppose all of these. Aspirin is actually an aromatase inhibitor. There is a study that is about to come out in the journal JAMA, and it says that aromatase inhibitors may be a viable treatment for heart disease. So there you have it. The enzyme aromatase, which synthesizes estrogen, is produced mostly under the effects of stress and inflammation. And some of the main triggers of production of more aromatase are the prostaglandins. And by inhibiting the production of prostaglandins, aspirin can decrease the production of new aromatase enzyme by 60 to 70%. So that's how it opposes estrogen. It decreases the synthesis of new estrogen. Aspirin is also anti-lipolytic, so it will inhibit the release of free fatty acids from the adipose tissue. And in higher doses, aspirin is actually a direct fatty acid oxidation inhibitor, very similar to a drug that was approved in 2006. It's called ranolazine. And ranolazine is actually a fatty acid oxidation inhibitor. However, it happens to be extremely liver toxic, and it has been recently found that it prolongs the so-called QT interval, which can lead to sudden cardiac death. So a safer substance that has multiple mechanisms of action, all of them known to be beneficial for heart disease and for stroke, is aspirin. Aspirin also lowers the levels of serotonin in the blood, which is and serotonin is one of the primary factors involved in blood clotting together with estrogen. It is responsible for platelet aggregation. So just by that's probably one of the main reasons behind aspirin's anti-aggregation effect, is because it reduces serotonin in the blood. That's the primary substance I would recommend. Anything else that inhibits the release of fatty acids or their oxidation, such as niacinamide, caffeine, progesterone is a very good one. Pregnenolone is also a very good one because you'll metabolize largely into progesterone. Testosterone, dihydrotestosterone, these are all good, but they happen to be prescription medicines. And in general, avoiding the polyunsaturated fats as in your diet, because without them, if your tissues are depleted or very low in these polyunsaturated fats, your body will not be able to synthesize the inflammatory mediators, and as such, there will be no inflammation in the blood vessels or very low, and there will be no need for cholesterol to go there and try to repair the damage and eventually contribute to the development of plaque. It's a very simple but very profound step everybody can take, is reducing the intake of polyunsaturated fat. Reducing another mediator is probably going to be helpful. Serotonin. Anti-serotonin drugs are well known to be helpful for cardiovascular conditions. Again, but they're all pharmacological drugs. They all require prescription. Certain good things you can do to limit your production of serotonin is eat easily digestible food, stuff that doesn't make it to your colon. You want everything to be digested and absorbed in your stomach, and if not, the small intestine. If anything reaches your colon, you'll trigger the production of endotoxin and serotonin. And also trying to limit the intake of foods that are high in tryptophan. Ray has talked about this many times. Tryptophan is the precursor to serotonin. If you're eating foods that are high in tryptophan, you will probably contribute to higher serotonin synthesis both in your gut and in your brain. And some things you can do is either increase the intake of gelatin, which basically opposes the synthesis of serotonin. It opposes actually the absorption of tryptophan from the gut. And aspirin here has another very good role. Aspirin is one of the few things that I've been able to discover, actually, if not the only one, that directly blocks the absorption of tryptophan from food. So you can take things like gelatin, or you can take the branched-chain amino acids to slow the transfer of tryptophan into the brain, etc., etc. But really, the primary thing that needs to be done is to prevent or limit its absorption from the gut. And taking as little as 2 tablets of aspirin with food, and you only need to do it once, has been shown to decrease the absorption of tryptophan from the food by up to 80%. So those are some of the things that I would do. Niacinamide is I think we already touched upon. It has several mechanisms of action that are very beneficial. The reduction in lipolysis is one of them, but I don't know if many people know that, but niacinamide used to be a treatment for arthritis, rheumatoid arthritis, about 50 years ago. The reason is that in higher doses, niacinamide has some very good effects. First of all, it lowers the production of nitric oxide. It lowers the levels of an inflammatory mediator called tumor necrosis factor alpha, and also lowers the levels of NF-κB. And these two are really substances that are involved in virtually every pathological condition: cancer, diabetes, heart disease, neurological conditions, neurodegenerative disease, dementias. Whenever you have these, you'll see that either TNF or NF-κB are elevated, and these mediators are only elevated if there is the precursors to inflammation in the body, which is PUFA. So limit PUFA, and that'll be my primary goal. And if not, then rely on some of these substances that act further down the cascade, but they're not as effective as just limiting the precursors in your diet.
And if you go to your physician or you get tests and your TSH is normal, I wouldn't be comforted, because at least one study showed that a normal TSH was associated with fatal coronary heart disease.
Absolutely. And another study in young athletes found that TSH, any number, any TSH level higher than 2 was pathological. The young athletes, and keep in mind, these are young people. The young athletes with TSH over 2 were found to have either heart enlargement, which is a precursor to a congestive heart failure, or atherosclerosis. They already had a very extensive narrowing of the blood vessels. And that's not surprising, given that the studies from the Korean War and the Vietnam War. But basically, TSH is a pituitary hormone, and like any pituitary hormone, if it is high, it means you're under stress, something is not working right in the body. On that line of thought, probably any other pituitary hormone, growth hormone is implicated in heart failure. Prolactin is implicated in heart failure and strokes. It's implicated in many other cancers, as well. Luteinizing hormone, follicular stimulating hormone, LH and FSH. Pretty much all of these pituitary hormones, if they're elevated for one reason or another, this is an indication that thyroid function is probably lacking, and one or more tissues or organs in the body are malfunctioning.
So that was it for me. Did you have anything else you wanted to talk about, Georgie?
I think that's pretty much for now. I just want people to remember and keep in mind that unlike what mainstream medicine is trying to tell you, the causes of heart disease are not unknown. They're very well known. They've been known for over 100 years. It's just that some of the therapies that are being currently in place are very bad for you, especially the statins and the diuretics. And they've been proven to contribute to development of these conditions and also to the lethality of these conditions. I think there was a study done in Austria in the 1950s which showed that before these mainstream treatments were popularized and thousands of people were put on them, people with heart failure were living with the condition for up to 20 years. Currently, with all of the modern treatments and everything that we can throw at that, the modern medicine can throw at that, I think the life expectancy of a person with a congestive heart failure is 3 to 5 years before they need a heart transplant. So you see something is definitely wrong with the approach, with the pharmacological approach that is there. So if you're in the 50s and you had this lethal condition that it is lethal now, you're likely to die from old age before that thing kills you. And also, I would like people to keep in mind that, I still recommend going to your doctor, but there are things that you can do in your everyday life that will probably have much more profound influence on your health than any medication that the doctor can prescribe. And I mentioned the primary thing is limiting the precursors of inflammation. In other words, the polyunsaturated fat, and also trying to limit as much as possible foods that are high in tryptophan, and also trying to limit foods that are high in the so-called resistant starch. As much as modern medicine likes you to think that this will somehow normalize your glycemic response and cure your diabetes, it's the exact opposite. You will raise your serotonin, and it has been shown that drugs that oppose serotonin can reverse type 2 diabetes in as little as 1 week.
Georgie, you're awesome. Where can we find more of your work on the internet this week?
I post a lot of studies and a lot of discussions on the Rapid Forum. The website is www.rapidforum.com. I also have a website and a few supplements if you're interested. The website is www.idealabsdc.com. And if people would like to contact me, I would prefer you do it over the forum because many other people will benefit from the discussion. But if you have something that you're not willing to share with the public, you can send me an email. My email is haidut@gmail.com. And my username is the same on the forum, so you'll be very easy to find me. I post a lot there. You search for a topic, it's likely that I either responded or contributed directly to it.
And one more thing, Georgie, should people just believe us, or should they do their own research and come to their own conclusions?
Absolutely do their own research. There's an old Bulgarian proverb: believe nothing of what you hear and only half of what you see. So as I said in our first show, I think it actually may have been even before the show, experiment is the ultimate arbiter. Not that I encourage you to experiment causing yourself heart failure or cardiovascular disease, but experiment with changing your diet a little bit and maybe even experimenting with some of these substances with your doctor's permission, of course, and see for yourself what a profound influence simple steps can make. Unlike modern medicine has put out this chimera, this lie that battling every disease is this act of courage, of heroism. It's like going to war. It's anything but. It doesn't work like that. The body is really not well geared to go on these crusades. Anything you do that interferes with the cell's normal production of energy, anything that raises your levels of stress, has been already proven, even according to the mainstream medicine, of dramatically increasing your chance of both developing these lethal conditions and even dying from them. So again, going on this stressful crusade may be the actual thing that's contributing to your conditions. It's simple things and keeping an open mind and questioning things and trying to figure out things for yourself. Everybody is different. Every approach will be unique. If your doctor tries to put you in a box with some other people and tells you that statins are likely to work in 90% of the cases, that's bunk. For every study that your doctor can throw at you, I can respond with 10 that disprove it. So if the situation is that bad, everybody will think, well, who am I supposed to trust? None of this makes any sense. as Ray Pete said, normally things are supposed to not make sense until suddenly, with the right information and the right answers and the right change in your environment and your diet, always suddenly they make perfect sense. So I encourage people to experiment and learn, take opinion from whoever you want, but keep in mind that it's that person's unique opinion, including mine. All I'm doing is trying to provide pointers for people to follow on and do their own research and make their own decisions.
Georgi, thank you so much, man.
Thanks a lot. Appreciate it.
That's going to conclude this week's episode. I'd like to thank Georgi again for talking with me today, along with my patrons for supporting the show and all the content I produce. Next week was going to be the osteoporosis episode, but so many people have been emailing me about the Q&A episode, I think I might push it up a week. So let me know if that's a good idea or a bad idea in the comments. Thank you so much for listening. The listenership of this show is just outstanding, and I get so many positive emails, positive comments, liking the podcast on YouTube, or adding a comment or your thoughts on what we could do better, or just telling us that you like the show is so heartening, and I sincerely appreciate it, and Georgi does too. With that, thanks again for listening, and I'll talk to you guys next week.